Hey everyone, it is Supervisor Nathan Fletcher here with you this evening. We've had an exciting day at the County of San Diego. We had obviously yesterday was a historic day. We had three actual new supervisors join the Board of Supervisors. Supervisor Nora Vargas, who you're going to hear from here in a minute, Supervisor Tara Lawson-Reamer, and Supervisor Joel Anderson. The county and the change that's happening. When I came in just 2 years ago, I think the average supervisor had, I don't know, 20, 25 years experience, and it is a new day. Now all five of us, I would be the most senior supervisor, only because I was sworn in a few minutes. Oh, there's our vice chair.
Hello.
Welcome, Vice Chair Nora Vargas.
How are you?
You had the moment of the day. You're like, no. If you don't know what we're talking about, go watch the swearing in video from earlier. It was epic.
I was just being me.
Yeah, no, it was great. It was great. How are you?
I'm doing really good. I'm doing day 2, and it's been awesome.
You're still having fun?
I'm having a lot of fun. It's great. It's great. I love it. I think I'm right where I'm supposed to be. So I feel good. I feel good. And I'm really excited about the work that we're going to do together.
Yeah. No, Nora, I've told so many people, I said, one, look, you're making history. The first Latina in the hundreds of year history of San Diego County to serve on the Board of Supervisors. And other than my wife, there could not be a better Latina here. And I gotta say that.
I love your wife
she
too.
Loves
so
you.
We have something in common, right?
Yes. She loves you and thinks the world of you. But I've told for so many of you out there, so many of you are going to be familiar with Nora and really know everything about her. But Nora is going to bring such an incredible poise, passion, composure, commitment. But I think what's so important is particularly for communities that have historically not been fought for, to have someone who's going to fight for them every single day. And, Nora, I said today at the thing, but you know how and why you serve, but you also know who you represent. And I know you're going to hold county government accountable. You're a part of it now, but you're going to push and ask questions and fight and be tremendously effective. And, I thought it was so wonderful on your second day as a supervisor. You're the vice chair of the board. You're joining me on the COVID-19 subcommittee at a really difficult time. What we're going to face over the course of the next 6 weeks with the new strain. We now have dozens of cases of the new UK variant that's here. The hospitalization increase we're going to see, 21 to 24 days after a spike, and we're going to get those holiday cases. And so, we have a lot to go, and I just couldn't be more proud to have you on board and have you helping day to day in the COVID response.
Well, I want to say, I'm excited about it, but it's also, and I was telling people about this yesterday. I don't know if you noticed, but giving my speech was a little bit bittersweet for me, right? And part of it was that my dad is in the hospital, and I always try not to put my business out there because it's my dad and my family. I want to be respectful, but my family was hit hard by COVID, and we're lucky that he has insurance and he's being taken care of. But and I have wonderful sisters and a brother that are helping me in this process and navigating the system and all of that. And my sister's a nurse, and so we got this, right. We know how to do this, and so it's what going through these experiences is what I think helps me do this work every day. That I know there's a lot of folks who have to work 3 jobs in our communities who, are trying to figure out about their kids and childcare and all these different things. And I think that's where we can make a big difference. And I think that together with the rest of the board members as well, we're going to be able really to do good things that are going to be impactful.
Well, and you should tell your personal story. I mean, that's what makes us who we are. I mean, it's all, people think somehow, none of us are detached from the realities of what we face. And whether it's, I talk a lot. I mean, 3 of our 5 kids are still at home.
Yeah.
And the challenges of doing the remote learning. And look, we have a ton of privileges and advantages. I mean, we're both employed. We haven't missed a paycheck. I mean, there's a lot of things that makes it easier, but it's hard and it's real. And I think, I think, Nora, one of the things that gets missed is there's a disconnect between the actions we take and the outcomes we get. And none of us want to close anybody at all. I mean, no one runs for office to say, when I get elected, I want to close restaurants. I mean, that's just a It's lunacy.
Yeah.
But we can't avoid the difficult situations and challenges. And you know, we can rebuild a lot of things, but you can't rebuild a life. And you know, when you look at those numbers every day, you know, so many people around Christmas are saying, well, I shouldn't have to give up spending it with my family who live in another area. And I'd say, man, there's 1,600 San Diegans that are not spending it with their family members, not because they're choosing to be safe, because their family members are dead.
Yeah.
Like, this is real. This is real. And we don't have to do it forever. It's just, we just got to sacrifice for each other for a little bit. And then we get through it, and then we rebuild.
Yeah. And I think, you know, and I think that's, I think, the important piece of it. I mean, it's really, how do we work together? And I think, you know, you said this a couple of times during the year where, you know, we keep politicizing healthcare is not the right way to go, right? I mean, people can't keep hearing mixed messages from our board of supervisors, especially when the work that we're doing is data based and, you know, based on science. And we need to knock it off, because when people hear different conversations from different folks, I think it creates a lot of tension. And especially as we're getting into this new world of the vaccine distribution, it can't be, you know, theatrics. We really need to get together, unify, and really get it done, because this is a global pandemic. Nobody's been through this before. And so we are working on it together, and we need to figure out how to do this and do this well.
Yeah, and I think, and we'll get in here in a second to what we're bringing forward to the board. But you know, that has been one of the great frustrations. I think, you know, there are issues where, look, there's going to be differences of opinions between progressives and conservatives and Democrats and Republicans. And, you know, we could have a debate about, you know, how many days you got to wait to get a gun, or what gun you can have, and have real differences. But, you know, if there was ever a moment, and if there was ever a time where we just came together to work the problem, you know, COVID pandemics are not ideological. And you still there?
Sorry.
Whoa, lost you.
Sorry.
You're only 2 days in. You can't be falling off yet.
And I'm dead.
No, you're good.
Sorry.
But you know, like, whether your focus is public health and saving lives, or your focus is getting businesses open, we do the exact same thing. We slow the spread, and we keep our numbers down. And you know, that's been one of the great frustrations is, you know, we had this pandemic hit at a time of federal just abdication of any responsible leadership by the president. And he set a tone that others could emulate. And this disinformation, you know, so much of what we fight is not a disagreement over a level of risk. It's just things that are just factually not true. And so we've got to find a way, we've got to harness in. And so that's why I'm excited, Nora, to bring forward on Tuesday with you a letter before the board. And if adopted, look, we just want to speak, at least the majority of the board, speak with a clear voice to say we trust science, we believe in public health orders that are there. We understand we cannot avoid the difficult decisions we have to make. They are difficult. We don't want to close anything. We don't want anyone's business negatively impacted, but we can't avoid that. And the economic damage would be far greater. And so to really come before us at this point of maximum peril, with our cases increasing, our hospitalizations under duress with the new strain, and then what we know is likely to be just in front of us from the holidays, you know, I think it's an important time for us to come and make a clear, definitive statement as a board. To hold on with that. Oh, she's back. Hold on. We lost Nora for a sec. Oh, you're back.
Sorry.
No worries. No worries. So what are you seeing in the community? I was just talking about, you know, we're going to bring forward and at least get us on record of saying, look, this is the approach of the County of San Diego as it relates to COVID. And we're going to work with the state. We're going to rescind all of the previous letters and stuff we get against the state of California, and at least aim to have the majority of the board speak with a clear voice. And then the second piece of that I know is so important to you, and I've heard from you, and I know it's important to your district, is as funding allocations are made around COVID, they've got to recognize the proportionality of who's been hit hardest.
Yeah.
You can't just take a pandemic that has hit certain communities at 2 or 3, 4 times the rate and give everyone equal response. And so laying out as a county, look, we're rescinding all that nonsense we did last year, attacking the governor and attacking public health orders. We're going to prioritize our funding to meet the need based on data and health equity We're going to work collaboratively instead of antagonistically with the state, and reaffirming we're going to rely on data and science to drive decision making.
Yeah.
I think is a good step. And I know it's a lot that I've heard from you as a priority and important.
Yeah, no, and I think, I think the piece that's critical on this is, we did a lot of the community work during the summer, right? And we have a lot of the organizations who are the safety nets, who are on the ground, and hearing from them and firsthand about sort of the way the distribution of the CARES Act and the impact that it had, right? I heard from Mayor Mary Salas, right? Second largest city in the county is Chula Vista, and how they were impacted because of the way the formulas were created. And I think we have an opportunity now to do things differently with the new leadership and to really think about health equity from that lens, because data is data unless you actually are looking at it from an equity perspective, because it's not the same where you have to look at a community that may not have access to healthcare. And I've been fighting to make sure that our communities have access to healthcare for decades, right? And that's what made me decide to run for the seat, because of public health and what that means. And so I think, when you think about, for instance, the Latino community, we're 34% of the population, and yet we're over 56% of the cases in COVID. It's not because Latinos get more COVID than other people. It's because of, who we are, where we are in the region, access to healthcare. And I think we have an opportunity to change that. So that we can allocate the resources and get people back into their routines. And I think that's one of my biggest priorities.
Yeah, no, and that's something, we just have to do. It is the right thing to do. It's the right way to respond to this. And, we've tried as hard as we could, Nora, here to try and push testing sites more, make sure those are more available. I know early on this, I heard from a lot of folks, yourself included.
Yeah.
We had a lot of members of the Latino community that wouldn't get tested because they may not qualify for traditional unemployment.
Yeah.
And that was, I don't want to know if I'm sick because then I got to choose my health or feed my family. And that's when we put our income assistance program up.
Yep.
Look, we will make you whole. You don't have to choose between your health and your kids. And then there weren't a lot of safe sites. People are fearful, particularly of government agencies and entities in the Trump era. And that's where we partnered with the Mexican consulate and the Catholic Church to create a network of safe testing sites. And, with you here now, we can take that same drive, but really ramp it up. Yeah. Because you do represent the community. You are the community. And I think that voice you're going to carry. I'll certainly listen. I'm good at doing what Latinas tell me to do. I do it every day at home. I hear what needs to be done. We can push and do it.
Yeah.
But I think our board letter will send a strong message.
Yes.
And at a point when people need to hear it.
Yeah, I think it's really important. I think people say I've had a lot of different conversations. I toured a couple of sites this weekend. I've been talking to folks, and what I keep hearing over and over is more needs to be done right now, because we just can't keep going at the rate that we're going. I think the county has the resources to move forward and to make some of these changes. I think what we've seen, the innovative work that has taken place to do the testing at the border is very unique to the work that we've done. And we are a binational region. And I think that it should matter to North County as much as it matters to South County, what happens in our binational region. If we are a mega region, we need to be looking at it from that lens as well. It is having a huge economic impact on our small businesses when we can't have, our communities have the lives that they've always had, which is going back and forth, right? And it's, as much as we want to open up our borders and do all of this, we can't right now because of where we're at, and we have to mitigate the pandemic. But we need to think about all these things and what does that look like. And I'm really hopeful. I'm going to be honest. Not only for our board and where we're moving, how we're moving forward in these letters, and it's just the beginning of the work. But I think it'll set the tone for the work that we can do with the Biden administration and having Javier Becerra, as our Health and Human Services representative, because I think he understands our communities very well and understands the power of the county. And I think that together we can really advocate and bring additional resources down to our communities.
That is one thing I think where there's an opportunity. You have great experience at the state. You know how the legislative process works. Tremendous experience there. But when we think about, look, we've got a new mayor
Mm-hmm.
who we can work with closely, and it's not the whole county's not the city of San Diego. I get that. Chula Vista is second largest, and Mary's wonderful, and we all love Mary, and we work closely there. But when we get the county aligned in supporting our cities,
Yeah.
we're tied by geography, and then we look at the opportunity we have at the state, where we can align with the governor and legislative leaders. I mean, you think about the chair of the Appropriations Committee, San Diegan,
Yeah.
the president of the Senate, San Diegan. I mean, we have an incredible delegation. And then when you look at the federal level, I mean, we have a Californian in the White House, and our vice president. And we have Javier, who you just said, who we both know.
Yeah.
And who will be our Health and Human Services Secretary, who is a Californian, who's worked with us. He's been down here. He's toured our things. He knows what we do. And we've got a really strong congressional delegation here in San Diego County. And so I just think there's so many opportunities for us, as we move forward, dealing with COVID, making sure we do the vaccine right. It's a little bit of a mess right now, but we're working on trying to nail that down. And then the rebuilding. I just think there's tremendous opportunities.
Yeah. I'm excited. I think I think more than anything, what I keep saying to folks, and I was speaking to Supervisor, Lawson Reamer today, and I said to her, I think the power of this board is that we all want the same thing, right? We may have different priorities around public policy, but we all want transparency, accountability. We all want community to be part of this, and we want people to have faith in government again. And I think we can do that together. And I think all of us come from different perspectives, but I think all of us want to make sure that people understand that we want government to work for them, because the better people do, the better we're going to be. And nobody, nobody wants to be standing in line for food, right? Nobody wants to be sleeping in a car. And I think we have the power to make some of those changes. And I think together we can do that.
We're going to know. Well, that's where we're going. Let's see if we got any questions. Let's see here. Savage San Diego, a lot of courage there, hiding behind a fake picture and username, says, I love the pandering. If you mean pandering to take care of people with underlying health conditions and the most impacted by our communities, then okay, call me guilty. Let's see what else. We got a lot of Go Nora. We got a lot of Nora fans in the house. Here we go. We fight. Yes, for immigrants, we will. Hold on. I lost it here. Can you still see me?
Yes, I can see you.
Nora, I am so proud of you. Congratulations, Chair Fletcher and Vice Chair Nora Vargas. Someone asked here, Brian asked a good question. Why close outside?
Uh-huh.
And I think this is something that I think we've certainly tried to communicate a lot here at the county. It's not that the outdoor settings and outdoor dinings are as risky or as concerning as indoor. That's not it. The indoor is much worse. It's when we get to a level of cases and a level of spread, we're trying to stop the mixing. We're trying to stop the transmission. And so it wasn't that long ago we were having 200 to 300 cases a day.
Yeah.
And now we have days with 3,000, 4,000 cases a day. And so when you get to that level, the stay-at-home order was really trying to get people to stay at home for a duration of time so that we can break that cycle of transmission. And so the purposes of a lot of pieces of that were really just designed to try and get people to not mix between multiple households. And so that was really good.
Supervisor Fletcher, I think the piece of it that I think as a civilian, like if you're not thinking about, people are not getting all the data that you might have been getting, right? I wasn't getting a lot of the data that I'm getting now and all that. Sometimes it's really putting into context about the greater good, right? If you are out, you get in a car accident, you're going to have to go to a hospital. And what we're trying to do is, we're hitting, we're at maximum capacity in some of these hospitals. What does that mean? And, I've heard firsthand, right, that we have ambulances sitting outside of, especially here at Sharp and Chula Vista and at Scripps. People want to treat their patients, but they're having to sit outside with the EMTs because there's no beds for our patients. I mean, I'll tell you, they sent my dad back with COVID and they sent him home after 3 days. And he's an older gentleman who needs oxygen, right? And dialysis and all this other stuff. But in my mind, he's critically ill, but in other people's, he's no longer in that, urgent care need. And so, the people who, all the people who may need to be in there can't get in there because there's so much, there's so much happening. And so I think it's putting it into context about sort of the bigger picture, that we need to kind of step back and say, like, I know I really want to go out. Everybody wants to go hang out with friends. I'm the first one that will say that to people, right? But it's really understanding what that can do to the bigger, the bigger picture, and hospitals and our doctors that are really saturated and are doing the best that they can.
Yeah.
But we need to talk about that a little bit more, I think, because I think people, there's a disconnect,
Yeah.
right? There's a
Well,
disconnect.
no, and I think you're spot on. I mean, when you look at and again, we sometimes get too focused on the charts and not the
Yeah.
stories, right? And I think you make a great point about that. And I'm guilty of that. Sometimes I can fall into the data, like, let me convince you with the data of what's happening. But that data tells a story, and we got to do a better job telling that story. But as you look at the massive increase in ICUs, in the number of folks that are COVID in ICUs, you see a massive shrinkage of non-COVID ICU patients. Well, what are those folks? Those are folks where hospitals are making a decision to say, you do not get care. And everyone says, oh, it's just elective things. But outside of cosmetic, there aren't that many things that are elective. They may be less urgent.
Yeah.
And so I've had hospitals tell me direct. They said, Nathan, we have had cancer patients that we've had to cancel their tumor removal.
Yeah.
Because we don't have space for them. There one poor guy needed a kidney transplant. They got the kidney, they got the guy. They said, well, you're going to have to wait because we don't have ICU space for you. And that's the point you're making right there.
Yeah.
And you see what's happening in LA. I mean, it was horrific. I think we mentioned it earlier that they're telling the ambulances, if that person loses a pulse in the ambulance, don't bring them here.
Yeah.
We don't have space for them. And that's what we have to, because I mean, that is a devastating impact on our healthcare. That's also a devastating impact on our economy.
Yeah.
And the only way, you have to do both. And there's only one way you can do it. Another anonymous account here says, Fletcher, you've done a great job eradicating the seasonal flu. It actually turns out the things that you do to avoid COVID help you avoid the flu, and the flu is less contagious than COVID. And so we have seen a massive drop in flu numbers, in flu deaths, everything we're doing. Of course, it hasn't, our hospital system is still full because of the increase in COVID, but it has been something there. Frank says more testing sites, please.
Yeah. I was going to say,
go ahead.
No, I was going to say it's important to remind people to get their flu shots. I think there's a lot of myths around it, and I think, I got my flu shot this year. They're try to make it easier in different locations to get them. EMTs and firefighters, especially in South County, there's a lot of different locations where people can go. The county has a site. You can call 211 and find out where those sites are. We have to make sure that people get tested, and I think the more not tested, they get their vaccine. It's important for the flu. They have to make sure they get it. And I think I was going to say, in terms of testing sites, I think I want to give a shout out to the Latino Coalition, Healthy Coalition out here in the community that's been doing a lot of the work with, handing out the kits, COVID kits, and really being advocates and being true partners of the county, because they really have made a difference. And especially in South County, with your leadership during the summer, making sure that we have more locations open, and even South Bay, Chula Vista Library, there was at one point lines would go around the library, and they modified things so that people can actually have access. And it's not perfect, but I think my office is open to hearing recommendations from folks, and we're going to do everything we can to continue to do that and have more testing sites and more locations that work with people's schedules.
Mm-hmm. No, and there are always ways we can do it better, and we got to look at it. Like, we have done, and we are doing significantly more testing per person than perhaps any other county. And another thing that's important, we learned a lesson when we had that summer surge. Our tests got backed up and how quick they were getting turned around, and that's not acceptable, because if you wait 4 or 5 days for a result, there's no point in getting the test. And so we prepped, we built. As we've had this surge, we have kept that turnaround time right there, the day to a day and a half. And we've been able to keep pace with, 25,000 plus tests per day, every single day in San Diego County. And so that's one area where I think we have done well. Let me see if we have any other questions. Treason is a crime. You're not above the law. Okay. All right.
Do that. You just kind of read it and keep going.
Yeah. Let me see. What about faster results at free testing? That's where, look, we're working to go as quick as we can. We're averaging about a day to a day and a half turnaround. They're not the rapid tests. That's a different test that is not as certain. The antigen test, they can turn around real quickly. We do PCR tests because if that gives you a positive, you are positive. If it gives you negative, you are negative. And so we're doing what we can there.
Yeah. The other thing I heard today from one of my team members who is really active in the community, they were saying, that when we send out the county letters, that the opportunity to actually connect the resources, so not just say 211, but go to this other website, other information where people can go and like, what do you do if you have COVID and all of that? And so the Department of Health and Human Services took that information down and they're thinking about what else could they do when they're sending out, the letters to folks who do test positive and what they can do beyond the contact tracing, because there's so much, the search is so much that I think it's being impacted on how people are being followed up with. And I think, the promotora model really works, right? Navigators, not just in the Latino community, in every community, right. It's really, really helpful because, again, we need to figure out a way to build trust in our communities when it comes to government and public health care, because it's just not there.
That's right. No, you're 100% right. We'll do a couple more questions, then I'll let you run. Carla says, regarding the vaccine, what percentage of vaccines received have been given to healthcare providers and elderly populations? Carla, I'm going to just quickly, super quick. The vaccine process right now is not how I would design it. You have vaccines going to a lot of entities independent of one another. So someone at the federal level said CVS is going to get them and they're going to do long-term care, and then every hospital and health system is getting them, and the VA is getting them, and DOD is getting them, and they're all kind of running their own programs. Right now, the only folks that are supposed to be receiving the vaccine are our healthcare workers. In particular, those healthcare workers at highest risk in acute care settings and hospitals, those that are treating COVID patients. And then we got to work through the sequencing. And I think it's important that we hold fidelity to that sequencing and not have people jump the line. And so we're working with the state. We'd like to have it a little more centralized at the county. Right now, we're kind of an air traffic controller. We've gotten some vaccines, but it's primarily for our staff who are in those settings, in those healthcare settings. But hopefully we can get greater clarity and coordination on the distribution of those vaccines. And we've done a lot. We did a whole program with paramedics to train them to be vaccinators. And, right now there's a shortage of folks that can give vaccines because the people that normally do it, doctors and nurses, they're really busy. And so paramedics stepped up and said, look, we'll work extra shifts and we'll do that. And so we're building out a workforce. We have the capacity to build out a network countywide of pods that people can go to. We just need the decision made to give the vaccines to the county, and then I think we could be in a position to do more distribution of those. But Nora, you've had a couple of briefings on the vaccine program.
Yeah, and I actually toured the facility with the firefighters this weekend on Sunday, and the process, to making sure that our first responders are getting it, and some doctors were walking up and getting the vaccine as well, and it's a very thorough process, and one that they want to make sure they have. You want to make sure that every time they open up a vaccine, they know that they have the 5-6 people that they need to be able to provide the vaccine for, because otherwise it goes to waste. So it's a little bit of a, like you said, it's like an orchestra, and you have to make sure that everything is in line. Otherwise, it's not going to be in sync, and it's really important. I think this is no joke, and I think we need to make sure that we're paying attention to what's happening, how we're getting this done. So
yeah.
I think they were able to do about 900 vaccines this weekend.
Yeah.
And then, they just opened up some other centers in Chula Vista and other areas. And so I'm working together with my, local elected officials to try to figure out how we continue to partner. Because I think it's not just government, right? It has to be community partnerships. It has to be trusted folks. How do we get, our nurses and our students who are out there that maybe can be part of this process if they're ready to be trained and get the work done. So
yeah, good. Let's do one more question here. Richard asks, how concerning is the increased prevalence of the new UK strain here in San Diego County? 24 confirmed cases just today. Richard, it's very concerning. And when we announced that, I believe it was just a week ago, I said, look, we know of one case, but we are certain there are more because that individual had no travel history. And, the fact that we now have dozens of cases and they're geographically dispersed and they're not people who just got back from a plane from London tells us that it is present and it spreads exponentially more. It is much more contagious. And the things that you do to avoid the regular strain of COVID are the exact same things you do to avoid this strain of COVID. You just have to be diligent and really disciplined about doing them. And so I think the surge on top of a surge coming out of the holidays combined with this new strain is what really gives me great concern moving forward. And then the defiance and the disinformation and all of that is making this much harder. And so, the hope, Richard, is folks can really come together and recognize, look, vaccines are here. We're doing it. We're not going to be doing this forever. We got to save lives. We got to save our economy. We've got to follow the public health orders, knock this thing back, get it under control, so that we can stay safe to get open, and then stay safe to stay open, and stay safe to save lives. Yep. Is really the hope of what we're doing right now.
Yep.
So wonderful. Well, Nora, I'm going to let you close us out. I want to thank you. I'm excited. Nora and I will be bringing a board letter for our Tuesday meeting. We have a whole framework for San Diego County. There's a lot of things we're going to be doing on Tuesday. A whole bunch of things will be rolling out over the coming days, but this one we wanted to highlight first, which is now, as my colleague on the COVID subcommittee, bringing forward a letter overriding previous board actions and statements that contradict having a response based on data and science, prioritizing future funding based on data-driven approach to targeted communities in need, taking into account health equity, working collaboratively instead of antagonistically with the state, and reaffirming our county is going to rely on data, science, decision-making to keep us safe. And there's no one better who could be here right now, Nora, than you. I'm thrilled to have you as my colleague, as our vice chair. We'll let you close it out.
Yeah, well, so I'm just going to say thank you. I'm excited. Today was an exciting day. I'm really looking forward to the great work. I really appreciated your comments this morning. And I think more importantly, this is about really working together to unify our county and to make sure that people have the resources that they need. And it's one thing to say that we're going to advocate for our communities, but to actually create policy that is going to be, in the end, effective. And we're going to use this data to create policy that's actually going to save lives. I think that's what really matters, because that's why we wake up every day, to do the right thing for our communities, so I'm excited about it. I think this is a new day in San Diego County, and I think that together as a board, we're going to be able to make sure that we move our communities forward. And what I keep saying to people is that we need a little bit of hope, and I think we see a little bit of hope with the vaccine. We see a little bit of hope with making sure that we have more testing sites. We get a little bit more hope with knowing that more people are are understanding why this is so important. And I think this is going to be what we need as a foundation to move forward, and hopefully, by the end of the year, we can get back to our routines. That's what I keep saying to folks, right? Let's make this our goal, right? We stick together right now, we do the right thing, and, hopefully by September, October, we can go back to a different type of normal, and making sure that we are able. I just want to hug my family. I really miss, I miss my cousins, my tios, and people, and that's the part that I think that's hard for so many of us. So, and getting together with my friends and the simple things, right? That we need to get our communities back, and economic recovery is a part of it. And we can't do that if people are not healthy, and we're going to do that.
Yeah. All right, everyone, let's give it up to Nora Vargas. She nominated me to be chair of the board today. She is our vice chair, COVID-19 subcommittee, first Latina in history. We're thrilled to have you on the board, Nora, and looking forward to it. Locking arms with you and charging ahead as we get through what we face. We'll get through it. And we have so much else to do. So thank you very, very much.
Thank you. Have a good night.
Thanks, everyone.
Thank you for watching. Bye.
Bye.